Lieutenant Detective Patrick Glynn of the Quincy, Massachusetts Police Department, who has been in charge of an innovative naloxone program in his city. So would you please tell me what was going on in Quincy? What were you witnessing in 2008?
2008, 2009, we're witnessing a huge increase in the spike of overdose deaths caused by opiates. At that time, there were a lot of grassroots groups that were coming around wanting something done. And one of the most poignant stories was a family member that answered a door one day when an individual was running for mayor and wanted to know what was going to be done about the illegal drug use and the illegal drug sales because their child had overdosed and no Narcan or naloxone was available at the time. From that point there, it just kind of catapulted to the point where we are today, where we have free access, all officers are trained, and the trend is spreading throughout the state and the nation now.
Okay, now you've been on the police force for 31 years.
That's correct.
And how did your mindset have to change in the policing that you've been doing for the first 2 decades of your career?
Well, the mindset, obviously, of law enforcement was to arrest. That was our solution: arrest, arrest, arrest. And in this particular situation, with the overdoses and the overdose deaths, we realized that people had a disease as opposed to actually being a hardcore criminal. Yes, they did do criminal acts, but they have a disease that needs to be treated first, and they could atone later for their criminal acts. But unless they're alive, it doesn't make a difference what type of crime they committed. They're not going to be held available for it, or are they going to be able to go into treatment? So we had to do something, and luckily we were able to start the pilot program with the help of a number of different agencies, family groups, Department of Public Health in Massachusetts, and come forward and be able to train our officers.
Okay, would you say your colleagues on the force, have they been wholeheartedly behind this, or did they take some prodding?
It didn't take prodding. Prodding would probably be a strong word, but it's like anything else that's new. We want to take a look back at it, step back, see what works, what doesn't. So there was some misinformation at first. People thought it was involving a needle, but it's actually a nasal spray. And the fact that there's no danger to the officer. In fact, there's no danger to the individual, even if they're not in an opiate state. It has a negative effect. It only has a positive effect if, in fact, they're in an opiate state for their respiratory system. So those issues were quickly dissolved, and we moved forward through that. And now every officer fully embraces the program, from the chief down to the newest officer, to the elected officials in the community, and even the citizens taking a totally different perspective towards us now.
Okay. And could you maybe tell me what are the most important legal or legislative actions that had to take place for you to change your strategies?
The first one was the amendment to the Good Samaritan law back in 2012. There were a number of amendments to it, but the two that stand out is, number one, it gave, if you want to use the word amnesty, for someone that had a small quantity of narcotics, 1 or 2 personal doses. If you were overdosing, you would not be charged with that. Or if a friend called on your behalf, they would not be charged with it. That was huge. That opened the gates for us to be inundated with 911 calls and able to get to the scene and help these individuals. The second one was also very, very important, where it allowed individuals with proper training and medical oversight to be trained, so we could go out and train outreach group workers, family members, in order for them to be able to have a supply of naloxone at home.
Okay, and several years into the program, how do you document its impact, and do you consider it an unqualified success, a modified success? How do you assess it?
I think it's a great success when we take a look at almost 500 reversals that were completed with police officers alone, that the public has looked at as totally different. They're calling us for assistance and referrals and information where they can send their family members. We get calls, we're inundated with calls. Our drug unit is, normally they get calls of complaints. They're getting calls of being praised and saying thank you for giving our son or daughter back. And it's every officer in the city of Quincy that deserves the credit for this, because they're the ones that are out at 3 o'clock in the morning and 3 o'clock in the afternoon reversing overdoses. So again, the public's perception has been tremendous in support of the program and in support of the police department.
Okay, and finally, we've been talking about a local program, but this is obviously a very national issue right now, and we're in the midst of a presidential campaign. What would you like to know from the presidential candidates on both sides about how they would address the opioid epidemic?
I'd like to see them take a different change of the mindset also, that treatment is what we need and there is more funding that is necessary for treatment. And just to kind of follow the footsteps of Director Michael Botticelli, who was in Massachusetts prior to coming to Washington, D.C. and being the drug czar, the director of ONDCP, and echo what he's saying, that we need more help out there for these individuals, because it is a disease that we're fighting. and it's not a criminal act. We want to get these people into programs so they can come back to the community free of drugs and be a productive member of communities.
Okay. And have any of the candidates on either side, have they really been addressing this issue? Do they have platforms on this at all?
There's a few of them that are talking about more beds and treatment, but what's concrete, maybe when we get down to the basic levels of the two candidates, there might be something else that will come out that's more concrete, but everyone seems to be behind the effort of treatment and more beds.
Okay, thank you very much, sir.
Thank you.